Class 12, Chapter 4, Reproductive Health. You have learned about human reproduction system and its functions in Chapter 3. Now let's discuss a closely related topic, reproductive health. What do we understand by this term? The term simply refers to reproductive health, organs with normal functions. However, it has a broader perspective and includes the emotional and social aspects of reproduction also. According to the World Health Organization WHO, reproductive health means a total well-being in all aspects of reproduction: physical, emotional, behavioral, and social. Therefore, a society with people having physically and functionally normal reproductive organs and normal emotional and behavior interactions among them in all sex related aspects might be called reproductively healthy. Why is it significant to maintain reproductive health? What are the methods taken up to achieve it? Let us examine them. 4.1 Reproductive health problems and strategies. India was among the first country in the world to initiate action plans and programs at a national level to attain total reproductive health as a social goal. These programs, called family planning, were initiated in 1951 and were periodically assessed over the past decades. Improved programs covering wider reproduction related areas are currently in operation under the popular name Reproductive and Child Health Care (RCH) programs, creating awareness among people about the various reproduction related aspects and providing facilities and support for building up a reproductively healthy society are the major tasks under these programs. With the help of audio, visual, and the print media, government and non-governmental agencies have taken various steps to create awareness among the people about reproduction related aspects. Parents, other close relatives, teachers, and friends also have a major role in the dissemination of the other information. Introduction of sex education in schools should also be encouraged to provide right information to the young so as to encourage children from reliving in myths and having misconceptions about sex related aspects. Proper information about reproductive organ, adolescence, and related changes, safe and hygienic sexual practices, sexual transmitted diseases, STDs, ITDs, etc., would help people, especially those in the adolescence age group, to lead a reproductively healthy life. Educating people, especially fertile couples and those in marriageable age groups, about available birth control options, care of pregnant mother, postnatal care of the mother and child, importance of breastfeeding, equal opportunities for the male and the female child, etc., would address the importance of bringing up social conscious healthy family of desired size. Awareness of problem due to uncontrolled population growth, social evils like sex abuse and sex related crimes, etc., need to be created to enable people to think and take up necessary steps to prevent them and hereby build up a socially responsible and healthy society. Successfully implementation of various action plans to attain reproductive health requires strong infrastructure facilities, professional expertise, and material support. These are essential to provide medical assistance and care to people in reproductive related problems like pregnancy, delivery, STDs, abortions, contraceptions, menstrual problem, infertility, etc. Implantation of better techniques and new strategies from time to time are also required to provide more efficient care and assistance to people. Statutory ban on amniocentesis for sex determination to legally check increasing menace of female ferticides, massive child immunization, etc., are some programs that might be mentioned in this connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analyze the fetal cell and dissolve substances. This procedure is used to test the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, etc. Determine the survivability of the fetus. Research on various reproduction related areas are encouraged and supported by governmental and non-governmental agencies to find out a new method to improve upon the existence one. Do you know that Saheli, a new oral contraceptive for the female, was developed by scientists at Central Drug Research Institution CDRI in Lucknow, India? Better awareness about sex related matters, increased number of medically assisted deliveries, and better postnatal care leading to decreased maternal and infant mortality rate, increased number of couples with small families, better detection and cure of STDs, and overall increased medical facilities for all sex related problems, etc. all indicate improved reproductive health of the society. 4.2 Population stabilization and birth control. In the last century, an all round development in various fields significantly improved the quality of life of the people. However, increased life facilities along with better living conditions had an explosive impact on the growth of population. The world population, which has around 2 billion in 1900, rocketed to about 6 million by 2000 and 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 at the time of our independence, reached close to the billion mark by 2000 and crossed 1.2 billion in May 2011. A rapid decline in death rate, maternal mortality rate (MMR) and infant mortality rate (IMR), as well as an increase in the number of people in reproducibly age are probably reasons for this. Through our reproductive child health care program, though we could bring down the population growth rate, it was only marginal. According to the 2011 census report, the population growth rate was less than 2%, 20 per thousand year, a rate at which our population could increase rapidly. Such as alarming growth rate could lead to an absolute scarcity of even the basic requirements like food, shelter, and clothing. In spite of significant progresses made in those areas, therefore, the government was forced to take up serious measures to check this population growth rate. The most important step to overcome this problem is to motivate smaller families by using various contraceptive methods. You might have seen advertisement in the media as well as the reporters' bills, etc., showing a happy couple with two children with the slogan "हम दो हमारे दो" we two are two. Many couples, mostly the young urban working ones, have even adopted an one child norm. Statutory raising of marriageable raise of the families to 18 years and that of males to 21 years, and incentives given to the couples with small families are two of the other measures taken to tackle this problem. Let us describe some of the commonly used contraceptive methods which help prevent unwanted pregnancy. An ideal contraceptive should be user friendly, easily available, effective, reversible with no or least side effect. It also should in no way interfere with the sexual drive, desire, or the sexual act of the user. A wide range of contraceptive methods are presently available, which could be broadly grouped into the following categories, namely natural or traditional, barrier, IUDs, oral contraceptive, injectables, implants, and surgical method. Figure 4.1a condom for male, figure 4.1b condom for female, figure 4.2 copper T CUT. Natural method work on the principle of avoiding chances of ovum and sperm meeting. Periodic abstinence is one such method in which the couples avoid or abstain from coitus from day 10 to 17 of the menstrual cycle, when ovulation could be expected, as chance of the fertilization are very high during this period. It is called the fertile period. Therefore, by abstaining from coitus during this period, conception could be prevented. Withdrawal or coitus interrupt is another method in which the male partner withdraw his penis from the vagina just before ejaculation so as to avoid insemination. Lactational Amenorrhea, absence of menstrual method, is based on the fact that ovulation and therefore the cycle do not occur during the period of intense lactation following parturition. Therefore, as long as the mother breastfeeds the child fully, chances of conception are almost nil. However, this method has been reported to be effective only up to a maximum period of 6 months following parturition. As no medicines or devices are used to in these methods, side effects are almost nil. Chances of failure through of this method are also high. In barrier method, ovum and sperm are prevented from physically meeting with the help of barriers. Such methods are available for both males and females. Condom 4.1 AB are barrier made of thin rubber latex sheath that are used to cover the penis in the male or the vagina and cervix in the female just before coitus so that their ejaculation semen would not enter into the female reproductive tract. That this can prevent perception. Nirod is reproductive tract. This can prevent conception. Nirod is a popular brand of condom for the male. Use of condom has increased in recent years due to its additional benefit of protecting the user from contracting STIs and IDs. Both the male and female condom are disposable, can be self-inserted and thereby given privacy to the user. Diaphragm, cervical caps and vaults are also barriers made of rubber that are inserted into the female reproductive tract to cover the cervix during coitus. They prevent conception by blocking the entry of sperm through the cervix. They are reusable. Spermicidal creams, jellies and foams are usually used along with these barriers to increase their contraceptive efficiency. Another effective and popular method is the use of intrauterine devices, IUDs. These devices are inserted by doctors and or expert nurses in the uterus through vagina. These intrauterine devices are presently available as the non-medicated IUDs, lips loops, copper releasing IUDs, CUT, CU7, multiloader 375, and the hormone releasing IUDs, progestate LNG20, figure 4.2. IUDs increase phagocytosis of sperms within the uterus, and the Cu ions release in suppress sperm motility and the fertilizing capacity of sperms. Hormone releasing IUDs in addition make the uterus unsuitable for implantation and the cervical hostile. IUDs are ideal contraceptive for the female who want to delay pregnancy and or space children. It is one of the most widely accepted method of contraception in India. Oral administration of small doses of either progesterone or progesterone estrogen combination is another contraceptive method used by the female. They are used in the form of pills, tablets, and hence are popularly called the pills. Pills have to be taken daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle. After a gap of 7 days during which menstruation occur, it has to be repeated in the same pattern till the female desire to prevent contraception. They inhibit ovulation and implantation as well as alter the quality of cervical mucus to prevent retard entry of sperm. Pills are very effective with lesser side effects and well accepted by the females. Saheli, the new oral contraceptive for the females, contain a non-steroidal preparation. It is a once-week pill with the very few side effects and high contraceptive values. Progesterone alone or in the combination with estrogen can also be used by females as injections or implant under the skin. Figure 4.3. Their mode of action is similar to that of pills and their effective periods are much longer. Administration of progesterone or progesterone estrogen combination or IUDs within 72 hours of coitus have been found to be very effective as an emergency contraceptive, as they could be used to avoid possible pregnancy due to rape or casual unprotected intercourse. Figure 4.3. Implants. Surgical method, also called sterilization, are generally advised for the male and female partner as a terminal method to prevent any more Figure 4.4a vasectomy, figure 4.4b tubectomy. Pregnancy surgical interventions blocks gametes transport and thereby prevent conception. Sterilization procedure in the male is called vasectomy and that in the female tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision or the scrotum. Whereas in the tubectomy, a small incision on the scrotum, small part of the fallopian tube is removed, figure 4.4b, or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective, but their reversibility is very poor. It needs to be emphasized that the selection of a suitable contraceptive method and its use should always be undertaken in consultation with qualified medical professional. One must also remember that contraceptives are not regular requirement for the maintenance of reproductive health. In fact, they are practiced against a natural reproductive event, contraceptive pregnancy. One is forced to use these methods either to prevent pregnancy or to delay spaced pregnancy due to personal reason. No doubt the widespread use of these methods have a significant role in checking uncontrolled growth of population. However, their possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstruation period, or even breast cancer, though not very significant, should not be totally ignored. 4.3 Medical termination of pregnancy (MTP). Intentionally or voluntary termination of pregnancy before full term is called medical termination of pregnancy (MTP) or induced abortion. Nearly 45 to 50 million MTPs are performed in a year all over the world, which accounts 1/5 of the total number of conceived pregnancy in a year. Whether to accept legalized MTP or not is being debated upon in many countries due to emotional, ethical, religious, and social issues involved in it. Government of India legalized MTP in 1971 with some restriction conditions to avoid its misuse. Such restrictions are all removed, important to check the indiscrimination and legal female fertilizers which are reported to be high in India. Why MTP? Obviously, the answer is to get rid of unwanted pregnancy, either due to casual unprotected intercourses or failure of the contraceptive used during coitus or rapes. MTPs are also essential in certain cases where continuation of the pregnancy could be harmful or even fatal either to the mother or the fetus of both. MTP are considered relatively safe during the first trimester up to 12 weeks of pregnancy. Second trimester abortion are much more risky. One disturbing trend observed is that a majority of the MTPs are performed illegally by unqualified quacks, which are not only unsafe but could be fatal too. Another dangerous trend to be is the misuse of amniocentesis to determine the sex of the unborn baby. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unproductive coitus and the risk factor involved in illegal abortion, as well as avoiding more health care facilities, could reverse the mentioned unhealthy trend. 4.4 Sexually transmitted infection STIs. Infection or disease which are transmitted through sexual intercourse are collectively called sexually transmitted infection STIs or venereal disease VD or reproductive tract infection RTI. Gonorrhea, syphilis, genital herpes, chlamydia, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent year, HIV, leading to AIDS, are some of the common STIs. Among these, HIV infection are most dangerous and is discussed in detail chapter 8. Some of these infections like hepatitis B and HIV can also be transmitted by sharing of injections, needle, surgical instrument, and etc. with infection person, transfusion of blood, or from an infected mother to the fetus. To accept the hepatitis B hepatitis B, genital herpes, and HIV infection. Other diseases are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swelling, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptoms in the early stages of infection and the social stigma attached to the STs deter the infected person from going to timely detected and proper treatment. This could lead to complications later, which include pelvic inflammatory disease, PID, absorptions, abortions, stillbirths, ectopic pregnancy, infertility, or even cancer of the reproductive tract. STs are a major threat to a healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the reproductive health care programs. Through all persons are vulnerable to these infections. Their incidents are reported to be very high among persons in the age group of 15 to 24 years, the age group to which you also belong. There is no reason to panic because prevention is possible. One could be free of these infections by following this simple principle given below. First, avoid sex with unknown partner, multiple partners. Second, always try to use condom during coitus. Third, in case of doubt, one should go to qualified doctor for early detection and get complete treatment if diagnosed with infection. 4.5 Infertility. A discussion on reproductive health is incomplete without a mention of infertility. A large number of couples all over the world, including India, are infertile. They are unable to produce children in spite of unprotection. Sexual cohabitation. The reason for this could be many: physical, cognition, disease, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner, especially healthcare units, infertility clinics, etc. Could help in the diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections are not possible, the couples could be assisted to have children through certain special techniques commonly known as assisted reproductive technology (ART). In vitro fertilization, IVF fertilization outside the body in most similar condition as that in the body, followed by embryo transfer (ET) is one of the such method. In this method, popularly known as test tube baby program, over from the wife donor female and sperm from the husband donor male are collected and are induced to form zygote under simul- simulated condition in the laboratory. The zygote or early embryo with up to 8 blastomeres could then be transferred into the fallopian tube. SIFT, zygote intra-fallopian transfer, and embryo with more than 8 blastomeres into the uterus. IUT, intrauterine transfer. To complete its further development, embryo formed in vivo fertilization, fusion of gametes within the females also could be possible, used for such transfer to assist those females who cannot conceive. Transfer of an ovum collected from a donor into the fallopian tube. Gift, gamete intra-fallopian transfer of another female who cannot produce one but can provide suitable environment for fertilization and further development is another method to attempt. Intracytoplasmic sperm injection (ICSI) is another specialized procedure to form an embryo in the laboratory in which a sperm is directly injected into the ovum. Infertility cases, either due to inability of the male partner to inseminate the female or due to very low counts in the ejaculate, could be corrected by artificial insemination (AI) technique. In this technique, the sperm collected either from the husband or the healthy donor is artificially introduced either into the vagina or into the uterus. Intrauterine insemination of the female. Though options are many available, all these techniques require extremely high precision handling by specialized professional and expensive instruments. Therefore, these facilities are presently available only in a few countries in the country. Obviously, their benefit is affordable to only a limited number of people. Emotional, religious, and social factors are also deterrents in the adoption of these methods. Since the ultimate aim of these procedure is to have children in India, we have so many orphaned and destitute children who would probably not survive till maturity unless taken care of. Our laws permit legal adoption, and it is as yet one of the best methods for couples looking for parenthood. Summary: reproductive health refers to a total well being in all aspects of reproduction, physical, emotional, behavior, and social. Our nation was the first nation in the world to initiate various action plans at national levels toward attaining a reproductive healthy society. Counseling and creating awareness among people about reproductive organs, adolescents, and assisted changes, safe and hygienic sexual practices, sexually transmitted disease, STIs, including AIDS, etc., is the primary step towards reproductive health. Providing medical facilities and care to the problem like menstruation irregularities, pregnancy related aspects, delivery, medical termination of pregnancy, STs, birth control, infertility, postnatal child and maternal management is another important aspect of the reproductive and child healthcare program. An overall improvement of reproductive health has taken place in our country. An overall improvement in reproductive health has taken place in our country as indicated by reduced maternal and infant mortality rates, early detection and cure of STs, assistance to infertile couples, etc., improved health facilities and better living conditions, promoted to explosive growth of population. Such a growth necessitated intense propagation of contraceptive method. Various contraceptive options are available now, such as natural, traditional, barrier, IUDs, pills, injectables, implants, and surgical methods. Though contraceptive are not regular required for reproductive health, one is forced to use them to avoid pregnancy or to delay or space pregnancy. Medical termination of pregnancy are legalized in our country. MTP is generally performed during to get rid of unwanted pregnancies such as rapes, casual relationship, etc., as also in cases when the continuation of pregnancy could be harmful or even fatal to either the mother or the fetus or both. Infection or diseases transmitted through sexual intercourse are called sexually transmitted disease. Pelvic inflammatory disease, PIDS, stillbirth, infertility are some of the complications of them. Early detection facilitate birth cure of these diseases. Avoiding sexual intercourse with unknown multiple partner, use of condom during coitus are some of the simple precautions to avoid contraction STs. Inability to conceive or produce children even after 2 years of unprotected sexual cohabitation is called infertility. Various methods are now available to help such couples. In vitro fertilization are followed. Transfer of embryo into the female genital tract is one of such method and is commonly known as test tube baby program.